Well, good evening, everyone, and welcome. My name is Dr. Ryan Herring, and I'm a dual board-certified preventive medicine and lifestyle medicine physician who specializes in concierge primary care here at the Susan Samueli Integrative Health Institute. Thank you for joining us during our free community lecture, Integrative Insider Live. Our main clinic has moved to the UCI campus. This brand new space was designed to best empower you on your whole person health journey. We also offer integrative services at UCI health sites in Newport Beach near Fashion Island, Pacific Breast and Oncology Hematology at Pacific Medical Plaza in Costa Mesa, Yorba Linda, and Laguna Hills. Before we start, I just want to cover a few Zoom housekeeping items. We are recording this session, and after the session, we will post this webinar on our YouTube channel. In this webinar, everyone will remain mute and with their video off, but please utilize the Q&A feature at the bottom of your screen for any questions or to communicate with us during the session. After the presentation, I will moderate a Q&A session. Now let's go on to the main event. For tonight's session, and because February is Heart Month, it is a crucial reminder that there are integrative health programs out there to help you regain your strength after a heart event like a heart attack or heart surgery. Hear about our cardiac rehab program from Efrain Cerrato, lead exercise physiologist at Susan Samueli Integrative Health Institute. This is an all-encompassing whole person care program that integrates education and supervised exercise within a collaborative team framework, tailoring care to your unique needs within a supportive group environment. This holistic approach fosters a cohesive atmosphere aimed at enhancing your health and recovery. See the kind of life-changing regimens our patients do and why this program can help lower your risk of death and future heart attacks. For 3 decades, Efrain Cerrato's career has been a dedicated exploration of the vast realm of health and fitness, fueled by a desire to help individuals attain their optimal health. His journey was shaped by diverse roles and experiences. During his formative years as a hospital corpsman, he laid the foundation for his future in healthcare. His experiences led him to pursue a career in exercise physiology, where he developed a deep understanding of the intricacies of fitness, evaluation, sports, and fitness performance, understanding the unique needs and goals of each individual, and crafting personalized strategies for success and peak performance. Cardiac rehab is where optimal health cannot be achieved solely by focusing on the physical, but also mental, emotional, social, and individual lifestyle factors. Please join me in welcoming Efrain to Integrative Insider Live.
Thanks, Dr. Herring. See if I can live up to that introduction. Thank you. Welcome, everyone, and glad everyone can join me tonight here at for this integrative talk. And this is a subject that's really, no pun intended, dear to my heart. I really love working in this environment with patients in cardiac rehab. I'm passionate about it. I understand it. And because of it, I think that this is one of the reasons why our program has thrived. It's something that we really focus and really made an effort to make it different. Change the dialogue from, let's look at it from cardiac rehab to preventative cardiology. We're preventing people from having another event. And what we've done here is really expanded and started thinking outside the box on how we can create a better environment for recovery. So let's move on. And so just a little bit of a roadmap. A cardiac rehab, we're going to talk about what is it. In general terms, what is cardiac rehab? Who qualifies for the service? What are the benefits? And then we're going to get into a little bit of statistics. I really kept that to a minimal. And then I'm going to give you a quick visual tour of our facility and what makes our program unique. So let's go ahead with the first section. And cardiac rehab, what is it? And cardiac rehab, most people think it's a gym. You're going to go into a gym. You're going to start walking on the treadmill, get on a bike, and exercise. Well, it's more than that. Cardiac rehab really stands as a cornerstone for preventative cardiology. It is a tailored approach that zeroes in on strategies and interventions to mitigate the risk of subsequent cardiovascular events. At its core, cardiac rehab is a personalized blend of education and supervised exercise. It's about giving the patient the confidence to lead a normal life. So, who qualifies? Pretty much anyone that's had a cardiovascular event. Now, these guidelines that I have up here I've taken from Medicare standards. Medicare is really very strict in how they approach cardiac rehab as far as reimbursement and what's covered. But PPOs typically cover everything here and a little bit more, but anything from a heart attack and bypass surgery straight to lung transplant, heart transplants, LVAD devices. LVAD devices are assisted devices for people who have heart failure, and is basically a battery pack that is pumping their heart. And also there's also things like coronary stenting, or if you had something where they had to go and do an angioplasty, all these things are covered. The phases. All right, so cardiac rehab is 3 phases. The first phase is if you've had a cardiovascular event, you had bypass surgery, you're in the hospital, it's usually light activity, such as sitting up, standing, walking a few feet, getting dressed. Phase 2 is really the core of what we do. It is focused on increasing activity, exercise tolerance. It is 3 times a week. You are monitored, and there's a plethora of education. We go over everything, and I'll get a little bit more into that later on. And then there is a phase 3. We don't offer the phase 3 here, but it's an independent and self-monitoring. Basically, you're supervised. You would go into a cardiac rehab facility, and you're now hooked up to a monitor. You're being supervised that you're doing what you learned in phase 2. The drawbacks of phase 3 is that it's not covered by insurance. It's an out-of-pocket expense. And because of how busy cardiac rehab centers are, there's only a few programs that actually offer it because of space limitations. And so the benefits, I'm just going to go right into the benefits of cardiovascular death. Research by Pinkert and Baskin at Ohio State, covered all this right here and really, it's really about enhancing blood circulation, boosting heart function, increasing energy production in the heart cells, reducing the chances of developing type 2 diabetes, and furthermore, incorporating exercise into a heart treatment that significantly decrease the likelihood of a heart-related death. Those are some of the benefits. And in just last year, in March of 23, a bold statement by the American Heart Association and American College of Cardiology stated that exercise therapy can be significantly more beneficial for heart failure patients than even some of the most recommended medications. Now, guided exercise therapy stands out as being even more efficacious than some of the leading medications in improving their quality of life. Now, I'm not saying that exercise is the cure or is the best thing for heart failure patients. All it's saying that is the quality of life is improved. Medications will take care of the issue, the problem, but when you start exercising, when you start learning what you can and can't do in the gym setting, when you start learning about healthy lifestyle, this gives you more of a perspective of, oh, I can do this. That's what our job is in cardiac rehab, giving the patient the power, the empowerment to be able to live a normal life. And that's what exercise does. It's almost a freedom that, yes, I can do this. And now the numbers. So here's something. While acknowledging the intrinsic benefits of exercise in cardiovascular care, an essential question arises: where does cardiac rehab fit in the recovery process post-cardiovascular events or diagnosis? So very important. Individuals who attend 36 sessions of cardiac rehab have a 47% lower risk of death and a 31% lower risk of a heart attack compared to those that only attend 1 session. The emphasis is on 36 sessions. And on the cost savings, yeah, you the cost savings are between $4,900 to $9,200 per person. Now, with the benefits and documented positive outcomes, is cardiac rehab still a pivotal place in cardiovascular care? Now, in this slide right here, I'm going to direct you to the left side. This was from the Million Hearts Initiative in 2017. Cardiac rehab continues to be vastly underused resource among Medicare beneficiaries. Only 29% of patients initiated cardiac rehab in the study, and a mere 23 attended 12 sessions. 17 made it to 24 sessions, and only 8% completed the full course of 36 sessions. Now, the graph on the right is really more impactful. And what I'm emphasizing here is that it's dose dependent. So between 2007 and 2011, this study was looking at veterans. Out of 43,319 veterans who underwent a coronary revascularization at a VA facility and survived at least 30 days, out of 43,000, only 2,900 veterans, 6.9%, participate in cardiac rehab. Of those, 465 patients attended at least 36 cardiac rehab sessions, of which only 69 died, compared to 13,279 non-participants. Right there, you're looking at the numbers that people who participate in cardiac rehab learn what not to do to return or have another event. And that is probably one of the more pivotal reasons why cardiac rehab and exercise are so important, especially when you're recovering from a coronary event. Now, our cardiac rehab program, Dr. Herring did a great introduction on what our program is, but it also lends itself to, it's a collaborative teamwork. And we specifically set it up this as a whole care person that integrates education, supervised exercise within a collaborative team framework in a supportive group environment. Those are very key points in what we do here. Collaborative teamwork, we have several programs that we run concurrently with cardiac rehab as part of an education. But more to the point, patients learn how their heart works. It's amazing that we take this human body and take it for granted and just look at our hearts and say, oh yeah, it just pumps blood. But I break it down and explain really, how does the heart work? What does the blood pressure and heart rate is telling you about your fitness and your recovery? What effects do your meds have on you? What is your true resting heart rate, and how do you use it for optimum recovery? What is heart recovery rate, heart rate targets based on medications, your training cycles? What is the importance of sleep? And how do you measure more than just the hours? These are things that we really, really press on to teach people how to look at their heart, how to look at their body and listen to it. And another thing that we do here is we also teach how to use wearable devices and as a tool that provide feedback. Most of us have either an Apple Watch, a Garmin, a Fitbit, but we're only like computers, we only use maybe a fifth of it. But here what we do is we really start diving in and going, look at the numbers. That's one of the things our patients get tired of probably hearing me say is, I always throw it out there. You're going to learn what your numbers are. What are your numbers? What's your blood pressure? What's your heart rate? What's your sleeping heart rate or your true resting heart rate? How many steps did you take? How many calories did you eat today? How many hours did you stand? These are all things that really play into the whole kind of, I lost my thought here, but basically is how your body is working, teaching you how to do that. So what does the facility look like? So right here, I just took some snapshots of our facility. We have the typical, of course, cardiac rehab. We're going to have treadmills. We're going to have bikes. We're going to have steppers. The other thing that we do here, I have the resistance equipment and specifically chose to have free weights, not machines. And more to the point is, of the free weights, most of my patients only do really body work. They do the weights, But it's surprising how much work and how much you can get your heart rate up just doing calisthenics. And the beauty of doing calisthenics and doing this resistance training and resistance exercise, as opposed to doing machines, is you're going to mimic more real life situations, carrying a bag of groceries, moving a cart, carrying laundry baskets, things like that, pushing carts, whatever it is you're doing, working in the garden, doing your own body work and movements that mimic that are much more important. I mean, machines have a place, but for our purposes, I chose to do something like this, which I saw as being much more important. And with that being said, we do integrate a little bit of high intensity interval training, which has been proven to work. And I'll cover that in a later slide. So part of the education as well is the teaching kitchen. This is part of what we offer as education, and patients will go in and learn how to cook a heart healthy meal. This is a state of the art of a kitchen, and you get to learn how to cook, what it means when you're eating, what the foods are, and you cook it and you eat it. And then the education rooms. We have two of them. We have a large room where we also incorporate Tai Chi, Qigong, but we also have a classroom setting. We do PowerPoint presentations. We have different providers come and speak to the patients about heart healthy habits, diet, exercise, sleep, relaxation techniques, things that all encompass cardiac rehab and recovery. And this is our team from is Dr. Malik, our director, Michelle Fisher, the nurse, and this is the fellow from last year. We have a new fellow this year, and then of course myself. And we have some sayings throughout the gym, and it's more motivations. And I love the last one, the one down here that says it never gets easier, you just get better. This is one of the things that people, it's on the door, and it's the last thing they see before they leave. It never gets easier, you just get better. And I'll explain why that's so important, because it's a pitfall in exercise. You're working, and you never feel like you're improving. But in reality, you're just getting better, and I'll explain how that works. So now, the nitty-gritty of cardiac rehab at the Samueli Center. So we do group settings of 8 patients. We're able to extend it to 10 patients, but depending on the severity of diagnosis on patients, we limit it to 8. It's just for safety reasons. Now, again, really did the group settings. Some facilities allow you to come in one-on-one or come in on your own, and you may have another person in another treadmill or on the bike. You don't know who they are. Here, I purposely chose not to do it that way. I'm an exercise physiologist. I'm not the best teacher. I've never had my chest cracked open. I've never been on heart meds. I've never experienced what it feels to have a heart attack. The best teachers are going to be your classmates, the people that are sitting around with you doing the exercises. You're going to have some that have been here 3 weeks, some that have been here 8 weeks, and you're the first one. You can see how everyone is at a different stage. And the person that comes in, it gives them more of a motivation. Oh, I'll be there in 4 weeks. I'll be there in 8 weeks. And also, it's more of a cohesive environment where the other patients give that support. They egg them on and say, come on, you can do this. And such a cohesive and supportive environment. I use something called the FIT principle, which stands for frequency, intensity, time, and type, as a framework for exercise. And I'll get into that in another slide. Patients take their own pre and post vitals. This is something that is so important. I know how to take a blood pressure. I know what the numbers represent. I want the patients to start recognizing what are their numbers. And that is so important that they start taking their own blood pressure. What is it? Why, what does that number represent? How do you feel? Exercise progression. So we do steady state cardio. We measure it in METs, and I'll talk about that. Intervals when appropriate, and the patient is ready. Some patients aren't appropriate and they'll never do intervals, and it really depends on where they're at. Active recovery. This is another pitfall when it comes to exercise, not just in cardiac rehab, but in the general population. Everyone, when they think about going to the gym, I got to work 3 days a week, 5 days a week, go, 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 go. Well, at a certain point, you're going to have a decrease in return. I force active recovery. I will tell patients, nope, today you're going to go easy. I'm going to keep you at this level, and I go over why that's important. And in resistance exercise, utilizing body weight and or weight, the weight machine, we have a weight stack or free weights. And then the education, this is something that's really important. We offer formal education, 30 to 45 minutes, 3 times a week. That is something that's very unique. A lot of programs do it maybe once or twice a month. We do it every single time a patient comes in, it is available for the patient, a 30 to 45-minute education session. And what does that look like? So these are the core components of cardiac rehab. When the patient comes in, we'll do a patient assessment. We go over their medications, their heart health history, their lifestyle. We have nutritional counseling here. They get to speak to a dietitian. Weight management. One of the benefits of exercising sometimes is losing weight and sometimes is gaining weight. Everyone thinks that losing weight is the number one thing. No, some people need to gain weight. Blood pressure management, that's a given. Lipid or cholesterol management. Through exercise, these things have been found to, exercise has been found to affect cholesterol. Diabetes management, tobacco cessation. This is something that, in today's days, if you're, after all the congressional hearings, after all the literature, all the research, and people are still smoking, this is something I just say, stop it. Psychosocial management, we have a psychologist that'll come and talk and do formal education. And of course, the physical activity counseling and the exercise evaluations. But the other thing we do here, and this is part of the formal education, is the culinary teaching, like when I showed you the kitchen, Tai Chi and Qigong, mindfulness and meditation, and acupuncture. That's one of the other exercise education components that are offered. So how does this all play out? The FIT principle, I talked about frequency, intensity, time, and type. So frequency to 3 to 5 days a week. We do 3 days a week here. After a certain period of time, I start emphasizing or suggesting do 2 days a week outside of here. So if we do 3 days of cardio here, patients should be doing 2 days of resistance training outside. If they do 2 days of resistance training in here, 2 other days of cardio outside. Again, it's keeping that balance. Intensity, light to vigorous. I used to hold patients back and say, no, we're going to keep you at 2 METs, 3 METs, and I'll explain the METs right now. What I find is that, if by holding people back, I'm not empowering them to go ahead and try something. Again, they're monitored, and I'll be able to tell if, no, this is too soon for you. We're watching their rhythm, we're taking their blood pressure. So again, we kind of go with it and see where they're at. Time, 30 to 60 minutes, and type purposeful exercise involving major muscle groups is pretty big. It's a formula or a menu, if you will, of how to apply exercise. Now the METs. I've been talking about METs. What are they? METs are metabolic equivalents, is oxygen consumption. Everyone sitting down right now watching this is doing about 1 MET. And that is a measurement, and this is my geek side coming out, 3.5 meters of oxygen per kilogram of body weight per minute, blah, 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 blah. Here's the way it works. If you're on the treadmill and you're walking and your cardiologist asks me, hey, how did Mark do? Oh, Mark did great. He was smiling. He talked to me a few times and he was on the treadmill for 20 minutes. I didn't tell the doctor anything. But if I tell the doctor, yes, so Mark was on the treadmill for 20 minutes, he was doing about 3 METs, his blood pressure did this. Now I'm giving him quantitative information on how you are progressing. And METs is a great way to measure oxygen expenditure. So 1 MET, we're sitting down. 3 METs is a 24-minute mile. 10 minutes, you're running a 10-minute mile. Really simple. And what do we measure? This is really important. When we do put everything together at the end, what's the end point on all this? So we measure exercise capacity and we measure it in METs. Again, like the previous slide, and I'm going to back up on the slide. we show right here 2 mets. You come in on day 1, you can only do 2 mets. As you progress, next thing you know, you're doing 3 to 5 mets, you're doing 6, 6.5, 7. We have patients that'll hit 9, 10 mets. That is an obvious way of looking that someone has improved. With that also being that we look at their blood pressure, we look at their weight. We do a score of questionnaires that measure depression, anxiety, quality of life assessments, activities, daily living, and a diet habit. In a perfect world, we'd ask for an echo or a stress test, because that could really give us an idea how the heart is working after completing cardiac rehab. So I'm going to go back to progression, because I talked about how do you know when you're improving. And this is a slide that I really, really love, because it really shows your progression. So on the top bar, you can see the genetic potential. On the left is basically a high and low. I left those out. And on the bottom is time. Everyone wants to improve from day 1 on the bottom left to the top right. Everyone wants to be at the top on day 1. It doesn't happen that way. There's a certain rate of adaptation. As your fitness improves, as you go up in fitness, your rate of adaptation drops. Unfortunately, what starts happening is you start to plateau. When you start getting that plateau, no one can see their improvements. Again, going back to what was on the door, it never gets easier, you just get better. It never gets easier because what we start doing is we start increasing the training complexity. We start throwing in other things that make it a little more challenging. We shake it up and make things, instead of just doing steady state and walking on a treadmill, say at 3 miles per hour, now I'm going to have you do hills every 30 seconds with an increase in speed up to 4 miles per hour. And in do jumps like that. Or if you're doing exercise, you're doing, say, for instance, you were doing push-ups. Now I'm going to add, I'm going to put your feet on a BOSU and do push-ups. Or I'm going to have you do something else that's going to challenge and make you start working a little harder. This is the progression. And our job is to continuously provide that feedback that you are improving. And the whole purpose of this whole thing is to empower the patient, to let them see how it is that, yes, I've had a cardiovascular event, but in the end, I can live a normal life. Life doesn't end because you've had a heart attack. And this is one of the biggest things that I really, really emphasize when people come into our program here is like, look, for lack of better terms, and I say this, the heart, for as complex as it is pretty simple. It's like a house. It's plumbing, electric, or structural. If your pipes are plugged up, they open them up, guess what? Now you got blood flow to the heart. It's going to work fine. It's just getting you back up to speed and give you that confidence. Yes, I can live a normal life. And that's pretty much my whole presentation right now. Thank you.
Well, thank you, Efrain, for that wonderful presentation. And I know that I learned a lot. And what I'll say is that it's very exciting for me as a lifestyle medicine doctor who is writing these kinds of lifestyle prescriptions for my patients to know that cardiac rehab is there, and for the right patient, it can really be life-changing. And what I love about it so much is that it's done in such a personalized way with supervision, so patients can feel very confident in the program and know that they can get a lot out of it if they're willing to commit to that. I want to remind the audience that you're able to submit questions if you'd like for us to answer those in the Q&A feature at the bottom of your Zoom screen there. So please submit any questions if you have those.
Dr. Herring, I love what you just said right now about if the patient's willing to take advantage of it, because it is something that, going back to the statistics that I talked about, where a certain percent, cardiac rehab isn't utilized as much. And this and it falls into this chasm where some patients feel they don't need it. And it's really discouraging. Now, and I'll tell you, a lot of athletes have done this. I've had friends, athletic friends, that have had heart attacks, and I tell them, you need to do cardiac rehab. And what's interesting is they say, well, I'm already athletic. I don't need it. Well, the whole thing comes down to is, well, do you know how to exercise? How much? How long? When is it too much? What's going on internally? How are your meds affecting you? These are things that no one really knows unless you're being monitored. And doing the sessions really gives you that freedom to say, oh yes, I can do this.
Yeah, and I love learning about all the other components of the program. And I personally, tend to think of that the bulk of it is the exercise, but when you really start including these other areas, learning about nutrition, stress management, sleep, okay, now we're really dialing this in, and we're going to get the most therapeutic response when we get the synergy of all those things working for patients.
And that is a component that is really, really important. The exercise is just part of it. And like you said, the synergy of having all the providers come and talk to people really, I mean, again, I'm an exercise physiologist. I can't tell you everything about diet. I can't tell you everything about mindfulness or meditation. Tai Chi, I'm not the expert in that. And this is where the experts come and talk to you and meet with the patients and really, really can expound on what the benefits, the global benefits of what we do here are. And again, it's really integrative. It's a whole body approach.
Absolutely. And we do have some questions coming in now. I'll go ahead
Okay.
and the first question here is, what are the best exercise approaches to move the values on an advanced lipid panel?
It's like a doctor. Okay, so exercise, just in general, I mean, it's just going to be exercise. It's just there's a curveball. Exercise in general is helping with with body fat. It's helping with fats. It's helping with metabolism. It's helping with your sugar uptake, fatty acid oxidation. These are things that play a role into it. I guess I was too generalized in directing that, yes, exercise is going to really target the lip. That was my fault, but
Yeah, and I can add a little bit here as well to that
thank you.
question. Um, you know, when we look at the totality of the program, right, all the components of the program, including the nutrition, I think it's the combination of all those things that are going to have the most effect on some of those advanced cardiac markers like, apolipoproteins, um, and those things that are part of that panel. But thank you for that question. Um, our next question is, after following this type of program, along with the benefits discussed, this person's wondering about, does it have results on things like abnormal changes on EKG or ejection fraction, or, certain things within, we can maybe even focus on perfusion of the heart, because that's probably.
So with what we have seen, again, this is going to be more generalized. I'm not a doctor, but from the background of the patients that we have, the population of patients that I've seen in cardiac rehab, we have seen improvements in ejection fraction. That is something we have seen. Okay, more specific to heart failure patients that are much more severe with very low ejection fractions, we have seen either a stabilization or an increase, a slight rise. Actually, I have seen rises in ejection fraction. So that is one of the benefits of cardiac rehab. As far as EKG changes, that's now you're looking at more of the electrical function of the heart, and that is outside the scope, my scope of really talking about.
Sure, sure. Now, another question we have is, how do I get a referral to your program?
Okay, so your cardiologist or your doctor, and more to the point, if you're, so this is where it gets a little tricky, depending on your diagnosis, and this is depending on the diagnosis, and if your Medicare is really strict. Like I said, when it comes to heart failure, if you have heart failure, your ejection fraction has to be below 35%. You can't have had, you couldn't have a procedure in the last 6 weeks and nothing in the next 6 months. I mean, it's very, they're keeping that down. Heart attacks within the last 12 months, but then stents, if you had a stent, if you've had, you know, right now off the top of my head, there's other procedures, you will qualify with it for it as long as you haven't already done cardiac rehab. So that's saying if you've already did cardiac rehab once under Medicare guidelines, you can't go back for the same thing and say, okay, I want to do cardiac rehab again. You know, the only way to get back in is you need to buy the ticket, and that one is a coronary event. And I don't recommend anyone doing that. But a doctor, your primary doctor can put it in, or your cardiologist.
Yeah, and that brings up a point from me as well too. You know, the reality is, you know, cardiac rehab is underutilized, and so it's good for patients to think about bringing up that discussion with their doctor. And you know, it's always good to go to your appointments too, with the intention to discuss that with your doctor if you're wanting to get that referral.
Yeah, and it's along the lines with the doctors, and I like just bringing it up because I've been in cardiac rehab for 98 years now, here at UCI, and it's interesting. I've had patients whose doctors have, that have requested cardiac rehab, and some doctors have said, "Well, you don't need it. Don't take it too serious. Um, go and live your life. Just exercise, go for walks." Like I said, my friends, and this is something that if you really, really want to do cardiac rehab, you shouldn't have to try to convince your doctor. But if you have to convince them, just tell them, just put the referral in. Because again, the statistics have already demonstrated the benefits of cardiac rehab. I mean, they're out there, and you see them every year. The new numbers come out. The benefits of cardiac rehab really are amazing. It's a 33% decrease in mortality. It's just amazing that it's not utilized as much as it should be.
Yeah, and along those lines too, I'm sure that there are some patients who have some desire for cardiac rehab, but you know, maybe they don't feel very well and they're wondering, you know, how am I supposed to benefit from cardiac rehab if I'm feeling this way, even though I may be eligible? How can patients find that, you know, motivation or support?
This is where, okay, I'm glad that's a great question. So here's where two things is getting the family involved, getting the family engaged. And is when they come in here, our job is really to motivate as well. Showing them gains, improvements, what you're doing does work. And going back to that slide with the graph, this is where our job is. Look, I have patients that come in, Efrain, this is still hard. Yes, because you're getting stronger. We do an assessment before. I do measurements of strength, flexibility, endurance, strength, flexibility, endurance before and after. I also do an anthropometric measurements, body composition before and after. So we do them on day 1, and then we do them on day 36. That is such a key, and it's so important. And the patients, I ask the patients, do you want me to share this with the rest of your classmates? Usually the numbers are always demonstrate an improvement. It always, always, always demonstrates an improvement. And it's amazing to see that they'll come in and say, I'm not improving. They get on the scale and they say, oh, I haven't dropped weight. I haven't dropped weight. I haven't dropped weight. And that's a big one. Everyone wants to lose weight. They get on the scale because we weigh them every time they come in. But at the end, I said, no, you didn't lose weight, but look how much muscle you put on. Yeah, you didn't lose weight, but you gained muscle and you lost body fat. Just because the weight didn't change doesn't mean you didn't improve. And this is something that is really hard. We're a society of looking at the numbers. Again, I'm saying, what are your numbers? But we're breaking it down in what do those numbers, especially when it comes to body composition, what do those numbers represent? It is so vital to really understand what those numbers mean. And not just with the weight, I also look at heart rate, resting heart rate, peak heart rate, recovery heart rate. What do those numbers represent? As your fitness improves, those numbers will change as well. Again, what do they mean though? That's where we come in. And the motivation, and hopefully, and I mean, that's where I try to motivate patients and are resistant. I can only give the information out. At a certain point, I can't force it to you.
Right. Well, it's nice to know that, with that eligibility criteria for getting into cardiac rehab, it's nice to know that, you do have some time, right? If in terms of the amount of time it's been since that heart event, for example, there is some time, but generally, right, we want to get them in sooner rather than later.
Within reason, yeah. Yeah, within reason. You're right. Some patients, when it comes after a procedure, not going around, but is one of those, like if they had bypass surgery, they cracked the chest open. Yeah, I'm not going to have them doing push-ups. That's not going to happen. But I can get them to start moving a little more, get them to start walking, get them to start using the bike, using their legs, get their heart rate up, get things moving around. Another component that people forget about is, yeah, they just came back out of surgery. 5 weeks later, they still have some amount of anesthesia on board. They're still getting used to some of the meds. That's all part of the recovery. Again, it goes back to that graph where everyone wants to be on day one here. By day two, they want to be at the very top. They want to already improving. It doesn't work that way. It's a slow progression.
So we do still have some more time if anyone out there would like to submit any other questions they might have. You were talking earlier, Efrain, about some of the wearables and tools that you might utilize. Now, for tracking exercise, let's say when patients leave cardiac rehab, are there any kinds of tools that you like for them to measure their exercise or keep track of that?
That is something that I go over during the sessions. I really hammer in what to look for. Again, I've talked about heart rate, resting heart rate is one of the big things that I say. What is your resting heart rate? How to track it? Because so really briefly, resting heart rate could be an indicator of fatigue. And how that works is, there's a way to measure it to really understand is fatigue. If you track it over a period of time, you'll be able to see that. A wearable is the best way to do it. If you have a watch, you sleep with it on. And then when you wake up in the morning, you take out your phone, you look at your app, and you'll be able to see how many hours did I sleep? How many, what was my resting heart rate? What was my peak heart rate while I was sleeping? Your heart rate will change while you're sleeping. What were your respirations? When people leave cardiac rehab, I really push on doing that. I also talk about MyFitnessPal, which is a way to track their diet. How many calories are you eating? What are the macro breakdowns of those calories? Your fats, your proteins, your carbs. How much exercise are you doing? How many calories are you burning? How many steps are you doing? Did you exercise enough? That's where the wearables come in. And again, a wearable is only, I like to think of a wearable as not so much that it's going to give you all the answers. All it is a touch. All it is that, if you haven't, and I'm going to use the Apple Watch, I'm not endorsing it or anything, but if you have an Apple Watch, every so often also they'll say time to stand up. All it is touching you, say reminding you stand up, which is so important. You have the rings on the Apple Watch, and sometimes even I've done it where I look at it and go, oh, I need to do 30 more steps to close my ring. I'll go and do 30 more steps. Is it foolish? No, because it's there for you. You have a goal set, and you can change those goals. You start doing that enough times, it becomes a habit that you need to keep doing. And sometimes what will happen is if you start following it enough, what happens is that you can't go a day without, oh, man, I got to do this. This is a goal. And, in running, they used to call it the runner's high, where runners, if they don't run, there's almost a sense of depression that happens. And it's like, nope, I got to get out and run. Whether it's just a mile or 2 miles, I got to go run, because they get that endorphin, that feeling. But again, it's going, hey, it's time to stand up. Hey, it's time to go work out. Hey, it's time to go to bed. My watch tells me when it's time to go to bed. It's really important that I stay on top of it. Otherwise, I'll just keep going.
Well, one other question that I had was you were touching on the nutrition a little bit. Are there just some basic components that you would like the audience to know about, sort of an optimal cardiac diet, or just some of the nuts and bolts of that?
So the basic diet that I recommend is the Mediterranean diet. Okay, I'm just gonna stick with that. Okay. So as an exercise physiologist, I can talk about diet. I can talk about exercise. I can talk about medications, diabetes, blood glucose, all these things. But I only have a license to do one thing: exercise. But I can talk about diet. So here's the deal with diet. The standard, if you have high blood pressure, the DASH diet. It's a low sodium diet. Okay. But for the most part, the Mediterranean diet really works. Or also a vegetarian diet. There are vegetarians and vegans, and that's fine as well. But it's something that really breaks down as a whole balanced diet: your protein, your carbs, and your fats. And unfortunately, in our society, carbs are the enemy. And unfortunately, that's been way thrown overboard. Carbs are so important. They're really important for recovery. They're so important for energy. And that's probably one of the more challenging things that I have with our patients, because everyone wants, nope, I don't want to eat carbs because they're going to make me fat. I wish the mindset and the conversation would get away from that, because carbs are important. Now, I'm talking complex carbs. I'm not talking going and getting donuts every morning. That's not what I'm talking about. Okay, I'm talking about oatmeal and something more of a complex carb.
Yeah, so it sounds like what you're saying there is, the general themes between those different types of dietary patterns are going to be focused on, minimally processed or mostly whole foods. And for some patients, maybe low sodium. But again, with our program, we have all this additional support and staff that provide that education, which is just wonderful.
Or dietitians are amazing when it comes to that. That really is, again, if you will, I tee it up and let the dietitians take over and let the professionals take over.
There was a couple other questions coming in here. One person was asking about that they've discovered some cardiac plaque and that they're interested in cardio care, that they were very interested in learning about that for awareness and prevention, cardio care.
So I think on that subject, I think the best thing here at the Institute, we have so we have group medical visits here. So cardiac rehab, and maybe it's something I should have brought up earlier. So cardiac rehab is a specific component, is the exercise education component that is, has been approved by CMS. You get a referral for it. One of the other things, I've had patients come in that want cardiac rehab but don't qualify. We have something called group medical visits that are preventive cardiology. Something like that, like what the guest was asking. I don't see the question anymore, but it's something that I think would benefit them because they get pretty much all the education. They just don't get the exercise component. That's the only difference, but they get all the education. And that's something that's offered here at the Susan Samueli Center. And you can go on I don't know if you can go on I think you can go on the website and get that information about group medical visits, cardiology. And that's one of the things that would benefit as far as that cardio care.
So I think we'll do one more question here. Someone asked if they've done cardiac rehab previously, is there any way to repeat it?
Like I said, you need the e-ticket, the golden ticket. Yeah, if you've already had cardiac rehab, no, not really. I mean, because you've already fulfilled what was recommended. Yeah, typically the only other way to do that is to have another event. I don't recommend that. That's not something you want to do. But here's the other side of it. The whole idea with cardiac rehab is to teach you a lifestyle modifications to live a normal life. And what you hear, you carry on in the future. I was talking about athletes. This is really interesting. Athletes that have had heart attacks and they're told, no, you don't need to exercise. It's interesting. They had a heart attack. There's a reason they had the heart attack. Obviously, what they were doing wasn't enough. What were they missing? That's what we do. We give them that information. All right, this is where you were at. Now let's really open up the Pandora's box and find out, okay, yes, you were doing the exercise. Yes, you were doing the diet, but what are all the other components you were not addressing? Because remember, one analogy I use in our classes is that care isn't, people are stuck looking at one tree. One tree is a data point. But if you walk around that tree, there's a whole forest full of trees, and each one of those trees are data points. But we get caught looking at just one tree, and we got to get away from it. So when it comes to cardiac rehab, I'm going to show you the forest. I'm going to go, here we go. These are all the data points you should be looking at. This set of data points may not apply to you, but they're going to apply to 30% of the other classmates. But yours are going to be here. And that's where that individualized care comes in. We give everyone the tools to learn what not to do to come back. Okay? It's about not returning. And that's what we do.
Very well said, Efrain. I want to thank you for all of your insight and your expertise. And I also want to thank everyone for joining our Integrative Insider Live. Upon ending this webinar, there is going to be a pop-up window which has a survey on this evening's event. So we'd really appreciate if you would fill that out for us so that we can continue to improve our community offerings.
Other thing I want to, if you don't mind, there's one thing I should mention. I was talking about the group medical visits, but one other thing that here at the Samueli Center, we have so many events that are taking place all the time. And the website is one place you can get information on that. But the next big event that the Samueli Center is going to be hosting is the Women's Wellness Day on May 3rd. You can find it on the website, but it's going to be at the Balboa Bay Club. But it's a great event. And in that event, again, like I just was talking about cardiac rehab, but there you're going to have people talking about diet. You're going to stress anything and everything that deals with an integrative approach to health and wellness. So it's something that I forgot to mention earlier.
Yeah, thank you for adding that. I know I'm looking forward to the Women's Wellness Day as well. So we will be emailing key takeaways to everyone who joined here to your email address that you provided at your registration. Our next Integrative Insider Live is going to be in June, and more information will be sent out through the Integrative Insider monthly emails and also posted on our events page. Again, our website there is SSIHI.uci.edu. Thanks again, everyone, and we will see you next time.
Thank you.